for Oboh.
You've heard the 5 p.m. news update. It's time for the big hard fact. From now until 6, let's dive deep into Lassa fever. We're discussing 2 disease outbreaks actually in the news. One is here in Nigeria and the other one is worldwide. Of course, I'm talking about Lassa fever and coronavirus. Now, here's today's big hard fact. According to the National Center for Disease Control, in the first 3 weeks of the year, Lassa fever killed 24 Nigerians. That was just in the first 3 weeks. Since then, the death toll has continued to rise. The current death count is 41. Well, it's Wednesday, so as usual, the newsroom has prepared a special report for you, and the report this week is about Lassa fever. Now, after you listen to that report, we're going to have a conversation, you and I. And we're going to have this conversation both about Lassa fever and about coronavirus. But first, let's listen to this report from our newsroom.
Did you know that Lassa fever is spread through direct contact with urine, feces, saliva, and the blood of infected rodents? Coming in contact with objects and surfaces contaminated with this also puts people at risk. The disease is a major public health challenge in West Africa, with Nigeria bearing the highest burden. It's a viral hemorrhagic fever caused by the Lassa virus, which is naturally found in rodents, especially rats. Symptoms include fever, headache, sore throat, general body weakness, cough, nausea, vomiting, diarrhea, muscle pains, chest pain, swollen face, and in severe cases, unexplainable bleeding from ears, eyes, nose, mouth, and vagina, according to Dr. Oboh Itoha, the president of the Association of Resident Doctors at the Lagos State University Teaching Hospital.
It causes bleeding from almost all parts of the body. That's what hemorrhagic means. Okay, so the individual that is infected can bleed from the ears, eyes, nose, mouth, vagina, anus, and finally die. So that is usually like the last sequence before death. So someone may be infected and in 3 days' time begin to manifest, or 3 weeks after begin to manifest. So you might find an individual within that period not having any symptoms but is actually infected. So that is why one needs to be on the alert regardless of symptoms.
Dr. Itoha is urging people to adopt the high standards of personal and environmental hygiene.
Then you must practice good personal hygiene. Avoid drying foodstuff outside on the floor where you know anything can just crawl over. Even bush burning, which can lead to displacement of rats from their bushes to human, try and avoid them. And in a home that is already rat infested, you need to handle them and try as much as possible to get them out. Never handle rats with bare hands, whether dead or alive.
There's been a spread in Nigeria with at least 40 people dead in 19 states by the end of January. This is out of more than 250 confirmed cases. Nigeria is contributing to research for the development of a Lassa fever vaccine. Even though there's no case of the disease in Lagos State, the medical director of the mainland hospital in Yaba, Dr. Abimbola Bowale, is assuring that the hospital is prepared to tackle any outbreak of any infectious disease. The mainland hospital is the Lagos Infectious Disease Hospital.
It's a 48-bedded ward. The first ward has 24 beds. The second ward also has 24 beds. So there are two separate wards. And the first ward, that is isolation A, is meant for patients who are suspects and they are coming in. So they come into that particular ward, we collect their blood samples, we take it to the lab, and then if the result is out, if they are positive, we move them to isolation section B, where they will be treated. The hospital also has a biosafety level 3 lab where diagnosis can be made and then treatment can be commenced as soon as the result is out. Our staffs are trained and they've also done regular drills just to remind ourselves on how to go about treating these patients. And then the materials that we need, the PPEs, the other materials that we need to ensure the safety of our workers is also available. So I think we are set.
Dr. Ohaku Itohan of the Lagos State University Teaching Hospital also says that the state government has inaugurated an emergency operations center and placed protocol at strategic positions at the emergency and the outpatients departments.
In Lagos, so far, what has been put in place, and in Lassa, specifically, includes having the Emergency Operating Center, EOC, instituted. And this EOC is meant to coordinate response to Lassa outbreak. Now, within Lassa, we have protocol that have been put in various strategic positions. We have it at the emergencies and also at the outpatient departments, the entry points in which patients come and we get contact with them, first contact with them. So these protocols have been put in various places so that as a medical personnel meeting any patient suspected or coming in with symptoms suggestive, we know how to take care of them. And in so doing, we are able to identify early, we are able to triage. Triage means setting aside any suspected case. So like in medical emergency now, we have an isolation ward that have been carved out aside the general wards for such cases if observed.
Thank you to the newsroom for that riveting report. Now, the first thing the report talked about was the way in which Lassa fever spreads. And we all know by now that it's from rats. Rat feces, bodily fluids. For hundreds of years, we've known that rats tend to spread diseases in urban centers. Remember that rats were the ones spreading the bubonic plague in Europe, you remember? And so all over the world, serious nations attempt to eradicate the rat population, especially in urban areas. So I want us to think about that. Let's think about and talk about what is being done about rats here in Nigeria. I don't think I have ever seen any government agency conduct a rat extermination exercise. And I'm talking about local government, state government, federal government. I've never seen government anywhere I live send people in to exterminate rats. And this is in spite of the fact that for decades, we have had this disease called Lassa fever hit us every year. And we know that it is rats bringing this Lassa fever. And yet, year after year, we're not seeing any serious extermination program from the government agencies responsible for sanitation, for public health, for pest control. So what exactly happens on those Saturdays when various state governments close up for sanitation? But maybe that's just me. Let me ask you, have you witnessed a government-sponsored rat extermination program here in Nigeria? Have you ever witnessed it? How often have you witnessed that? Tell us how it worked. And if you haven't, do you think the government is doing enough for pest control, especially rats, considering Lassa fever? And yes, it's actually the government's job to control pests. That's why you have a Ministry of Agriculture. That's why you have a Ministry of Environment. What are these people doing? How often have you witnessed a government-sponsored rat extermination program here in Nigeria? Have you ever seen it happen? How did it work? 01277 0993, 01277 1993, 01277 2993, 01277 3993. Again, the numbers are 01277 0993, 1993, 2993, and 3993. Have you ever witnessed a government-sponsored rat extermination program in Nigeria? How did it work? Do you think the government is doing enough for pest control, especially rats, considering Lassa fever? Hello, good evening.
Good evening, Sandra. How are you?
Good, how are you?
Well, Darlington.
Hmm.
Now, in fact, I tried to call in during your Aghogho matter because it's a past issue, but I hope you will repeat it.
Next week
Because
at 4.
nobody discussed the legal angle to that issue.
Next week at 4, calling.
It's okay. It's okay. He has no right to do that. Now, you know why they don't pay attention to rats? Because we see it as a harmless rodent. And so, why waste time and money? That is the way government views it. In crime, where they have seen the potential danger of this rodent, they take time. In fact, it becomes a government policy of the Operation Kill All the Rats. If there is a policy like that, I am telling you, no rat will be seen in any surroundings in Nigeria. But because government have not made it a policy, that is why these things show up all the time. The moment they realize the danger, Sandra, I am telling you, we may not hear about Lassa fever again.
They realize the danger. They know it's caused by rats. Every time there's a PSA from a government agency, they're always talking about how, stop eating rats, cover your gari from rats, protect yourself from rats. They know it's rats.
But since this thing has been showing up in Nigeria, how come nobody have made it a policy to kill all the rats?
Your guess is as good as mine, Darlington. Hello.
Hello?
Good evening. Thanks for calling.
Hello, good evening.
Yes, good evening. Welcome.
Yeah, this is Augustine.
Augustine, welcome.
Yes, just like the last speaker, what we need in Nigeria is just to declare a day. It's a day of eradicating rats. Encourage people to derat their homes, derat their surroundings. The gutter in your compound, you derat it. So that, just like you said, we won't be having cases of every year with the same thing will be repeated. In my home, I normally derat. Anytime I notice there is rat, I quickly go to the chemist and buy. There's a drug I buy from them, 50 naira. I use it to derat my home. So people should be encouraged to do it. Thank you.
Thanks for calling, Augustine. Because I'm glad, I'm pleased that Augustine brought up, people being able to take care of these things as well. Because as much as it is the government's job to do pest control, it's not entirely the responsibility of government. The entire responsibility is not with government. We have serious issues with personal hygiene and private sanitation. That's why I'm glad that Augustine made that point. And this is especially true in the area of food handling. Anytime there's a Lassa fever outbreak, government tells us to stop soaking gari, because if we eat gari without cooking it, we run the risk of ingesting Lassa fever because rats have touched the gari. But you see the assumption there? The assumption is that we have not stored the gari in a place where rats cannot reach it. We have not stored the gari in sealed containers. And even if we stored it properly in our homes, the assumption is that the trader that we bought it from did not store it properly and it got contaminated. Or even the people who processed and fried the gari left it outside to be sunned. This is food that human beings will eat, perhaps without cooking. I like to drink gari a lot. And yet, it is stored and handled in such a careless and dangerous way. And most Nigerians don't have a problem with any of this. I mean, Nigerians will tell you, Doti Belelo de kill African man, abi? They've been raised to think that these sanitary issues, no be big deal. Dirty no they kill African man. Wrong. Because dirty they kill lots of African men right now and women. And that dirty name na Lassa fever. So let me change tactics. Let me ask you, why our food hygiene practices as a society are so poor? Have you ever thought about it? Have you ever given it any thought? Why are our food hygiene practices as a society so poor? How do we go about educating ourselves and other people about better food handling? Whose job is it to do that? Is it government's job? Is it my job here on Hard Facts? Is it your job? Whose job is it to educate each other, ourselves, about how to handle food better? Why do you think our food practices as a society, our food hygiene practices as a society are so poor? 01277 0993, 01277 1993, 01277 2993, and 01277 3993. There's WhatsApp as well. Share your thoughts with me on WhatsApp. WhatsApp is 080 959 75805. 080 959 75805. Hello.
Sorry, Sandra. Good afternoon.
Good afternoon. Welcome.
Yeah. Jokingly yesterday, I was telling my wife, she said, she has bought like 5 plastic. The one for Gary, the one for rice. I said, from the place you are buying it from, did you know what has happened to that Gary that you are saying you are preserving? You understand? So, there is a lot to this thing. God will just protect us. And then, about the rat matter, please, I don't think we should be expecting any government, at least in Nigeria for now, to come and exterminate the rats in our house. Let's buy this in those, it's just 15 naira. If you care to give you, if you like yourself, at least just try, make your own effort. Don't wait for government to come and exterminate rats in your home. Thank you.
Thanks for calling us. Hello.
Hello, Sandra.
Good evening.
Good evening. Yeah. Yes, my name is Austin from Sule.
Welcome.
So I think it has to do with our general behavior.
Okay.
I don't know whether you have been to some of these places, a place that is supposed to know better. A lot of times I had to quarrel or talk to the people that are serving there, the sales there.
Okay.
You find out that generally they are not true. They don't wear gloves. When they want to serve you something like you go there to buy your birthday cake, for instance, and you see the way maybe they want to write happy birthday.
They'll touch you with their bare hands.
Blah, blah, blah.
Why do you think we're like that? Why do you think we're like that? Where does that come from?
It's just the lack of, I think it's just lack of education. We are not properly educated to know that some of these things are very important.
So who should do the educating?
Of course, like a corporate body, like like you have issues like that.
Okay.
It is expected that the management should educate their staff about handling of food.
Okay. Yeah, but
they don't do that.
But who's going to educate Mama Put Lady?
That is what I'm still saying. I'm saying the same thing. That when we come to the home base, the parents should do that. They should educate their children, like I do that to my children, that before you handle anything, you must wash your hands.
Okay.
It should start early. It should start with the parents. Let us leave government out of it now. The parents, mother and father, should educate their children on personal hygiene. You come from the toilet, you must wash your hands. Before you eat, you must wash your hands. So I think it has to start now. People should get to know that these are important. Then when you get to issues like that, it is on you to educate whoever is serving you. I've done that a number of times. I said the service there, do you know that before I eat this cake you are serving me, I'm not going to wash it again? Because there's no way you can wash it.
That's right.
Do you know that? Do you know that you are supposed to wear your hand gloves before you serve in a public place like that? They look at you funny.
Yeah,
but you need to let them know that it is proper. So I'm trying to tell each and every one of us, those listening to us, when you get to places like that and they are serving you, if their management has not done what is proper, there must people a time I have to walk out. I walk out of the place, even where after the guy has written happy birthday, this, that. I say, look at the container you are putting this thing for me. It's dirty. So I walked out, and that would serve as a lesson to him or to her that, look, it is very, very important. I think each and every one of us has to take it as a responsibility to ensure that, we are hygienic. Because it's very important.
It is. It really
I think
is.
it's an onus on all of us, not just the government, all of us, to begin to, do this property and educate others who may not know how important it is. That's my contribution. Thank you.
Thank you, Austin, for calling to make it. Hello, good evening.
Hello, good evening.
What's your name?
My name is Lady Jo from Festa.
Welcome, Mary Jo.
Thank you for this topic. You see, Sandra, I've noticed that most Nigerians are lazy.
Okay.
They don't take this issue of personal hygiene serious. I, as a person, I cannot live in a house where there's rats. It's not possible. Mistakenly, I think like 3 weeks ago, before this Lassa fever issue came up or so, I went out to buy, I think, bread or so. I came in, I was discussing with on the phone with my younger sister from Gori.
Okay.
Suddenly I saw rats in my house. I screamed. I said, God, they're very big rats. I said, how come in my house? You cannot see a hole that rats will I went to meet the young guys in my company. Every one of you, please come. I cannot sleep with rats in the house. It's not possible. So I had to find out. They killed that rat that day. They broke the even using clean that. I had to treat it because I hate rat as a person. And not knowing that causes Lassa fever. Why should we still be harboring rats? Nigerians are just lazy. That is how I see. They don't take the issue of personal hygiene serious.
How do we change that? What do you think we can do to change that?
Somebody just called. Like, I noticed you can buy Indo seed, for instance, put it in bread or rice. If you notice rats in your hands, before you know it, when they eat the Indo seed, they need to kill it up.
No, not about, exterminating the rats in our houses. I'm talking about how do we change the average Nigerian's attitude to personal hygiene?
The government should do more enlightenment that people should be hygienically cleaned. The government, and if the government does not do it yourself, my dear. If you die, you die too. Government will not care about you. That's how I see it. People are just lazy. We should wake up. I can't eat in a restaurant where if I even see in a restaurant, I won't eat there. I will leave.
Oh, sorry about that. Call me back if you can. But thank you so much for calling to share your thoughts. On Twitter, we have somebody, Joy Forever, who says that she's never seen an exterminator anywhere. Or do it yourself. Okay. Let's see. Do we have more comments? Okay, no. Let's see. Okay, no. All right. Let's take comments from WhatsApp as well. WhatsApp is 080-959-75825. If you just joined us, welcome. We're talking about Lassa fever and coronavirus. And because it's a Wednesday, we started by playing for you a special report put together by my newsroom. Now, that special report talks about how Lassa fever spreads. It spreads from the feces and the bodily fluids of rats. For hundreds of years, rats spread diseases in urban centers. So, serious countries try to eradicate their rat population, especially in urban areas. For Nigeria, I started by asking if you have ever seen a government sponsored extermination program of rats. And then we moved on to your own responsibility, because the entire responsibility is not with government. We have serious issues with personal hygiene. My last caller thinks that we are lazy as Nigerians. Another caller said that we don't know the right things to do. Corporate organizations should do better training with their staff. Government agencies should do more enlightening, my last caller said. Another caller called and said that he made a joke with his wife, who bought lots of things to store the gari and the rice that she bought. And the joke was, how do you know how the person who has already stored this thing in the market stored it? Because guess what? The way we handle food in Nigeria isn't very good. Because you buy your gari and you store it properly, but the assumption is that whoever you're buying the gari from also stored their own properly. And more often than not, that's not the case. Because you have government telling us every time there's a Lassa fever outbreak to not drink Gary. Because government is assuming that the Gary is not stored in a place that rats cannot enter the Gary. The government is assuming that we did not store it properly in a sealed container. The government is assuming that even if you, who is the end user, buys it and stores it properly, the woman in the market or the man in the market that is selling it did not store it properly, and so it got contaminated. Even if the person in the market who is selling stored it properly, the people who processed the Gary probably did not store it properly. They left it outside to be sunned. Food that you and I will eat, sometimes without cooking it. And it's handled very carelessly, very dangerously. And a lot of Nigerians will say, I beg, don't you know they kill African man? But we see that it is, in fact, killing lots of African men and women. So the second question I asked was, why are our food hygiene practices as a society so poor? How do we go about educating ourselves and other people about better food handling? Whose job is it, do you think? Do you think it's the government's job? Do you think it's the job of hard facts? Do you think it's your job? Whose job is it? I'm Sandra Ezekwesili.
This is Hard Facts. This is Hard Facts.
Lagos, here we are talking to you about your experience with personal hygiene. That's the question I was asking before the break. Now, I want us to talk a bit about coronavirus. I'm Sandra Ezekwesili, by the way, and this is Hard Facts. Over the weekend, there were concerns, remember, about whether it had entered Lagos or not, coronavirus. But the suspected case turned out, thankfully, to not be coronavirus. And since then, the state government has given guidelines for Lagosians returning from China, where the virus is rampaging. The government has said that these returnees should practice what it calls voluntary self-quarantine. Basically, they should stay in their homes and not have interactions with others. They should practice very strict personal hygiene. And if they notice that they have any symptoms, they should quickly report to the authorities. Now that has caused a lot of debate. That directive has caused quite the debate. Some Lagosians are very concerned that, simply put, this policy will not work. I talked about it on the Big Three on Monday. Remember, I reminded you about Patrick Sawyer. This was a man who, even though he already was in a hospital and already had been diagnosed with Ebola, did not submit to the authorities. He did not want to submit to the authorities. He tried to run away. He tried to use his connections to escape. He made phone calls to many powerful people that he knew in government, all to escape from quarantine. We had a guest on the show yesterday when we were talking about World Cancer Day, Dr. Makinde. And Dr. Makinde said that when he was put on Ebola duty, he was at the airport. And he was trying to screen people at the airport who had just come in. And one woman refused to be screened because she was the governor's wife. Now, like in the case of that woman, we had Dr. Makinde. In the case of Patrick Sawyer, thankfully, we had late Dr. Stella Adadevo. She got in the way. She stopped him. She sacrificed her life to stop him by holding him and infecting herself. And on Monday, I remember I asked you to tell me, to imagine what would have happened if somebody like Patrick Sawyer had been on self-quarantine in his house. Imagine that. I asked you if you truly believed he would have reported himself if he developed symptoms. Think about it. Imagine that. On Monday, I said that you have to expect that people will behave like Patrick Sawyer. As if I knew. As if I knew. We now have news. A news report from China that a man escaped from Wuhan and lied to everybody about it. He told people that he wasn't coming from Wuhan. He said he was coming from another city. They said that even when he started developing symptoms, he hid his symptoms. He refused to report himself. And when people around him reported him, he still tried to conceal his symptoms from the authorities. Thankfully, the Chinese authorities were able to identify him and trace him as a resident of Wuhan. So they immediately knew that they were dealing with coronavirus. And the man is now under quarantine. Now imagine that kind of thing happening here in Lagos. Imagine if somebody who reasons like this man comes back from China and was told to go on self-quarantine. Do you think the man will report himself to the Lagos state government? So again, like I asked on Monday, I'm asking you again, what do you think about the Lagos state government's directive for returnees to self-quarantine? And don't forget the first few questions I'm asking. Have you ever experienced a government-sponsored rat eradication program? Rat extermination program. Have you ever seen that happen? And how do we get Nigerians to handle their food better? So several questions I'm asking. Feel free to answer any of them. Feel free to talk about any of the points that I've raised today. Our numbers are 01277 0993, 01277 1993, 01277 2993, and 01277 3993. Hello, good evening.
Hello, Sandra. Good evening.
How are you? What's your name?
Yeah, I'm Ezekiel. I'm calling from Oboh.
Welcome, Ezekiel. Go ahead.
Yeah, when people are blaming the citizens for lack of hygiene, it seems to me that some people don't actually come to terms with what is called leadership.
Okay.
Because the point is this: if leadership has been understood, in fact, what is even National Orientation Agency doing? With every cases of emergency that have occurred in this, did you see or hear anything from the National Orientation Agency? Now that is to say that there is failure of governance. It is the duty of the government to be at the top of every situation. When the government is doing the right thing, though it is said that charity begins at home, but we cannot overrule the place of leadership in everything. That is key. So when people are blaming the citizens, people are being lazy, who made the people to be lazy? When government has done or is willing to do the right thing, you said that whenever there is a will, there is a way. But when the willingness is not there, then everybody begins to do, it's just like if there is no law, then people begin to embrace anarchy. So the government is meant to be blamed.
Okay.
Thank you.
All right, Ezekiel, blaming the government. Hello.
Yeah, good evening, Sandra.
Good evening. What's your name?
My name is Paul, calling from Egbeda.
Welcome, Paul. Go ahead.
Yeah. I think that we are not being sincere to ourselves.
Okay.
In this part of the world, we know that we don't have a government setting that is out to look after the masses. We should not pretend over it. Take a look or take a stroll. Go to any local government council headquarters. In Nigeria, there is no excluded state. And check their health official department. You will see grasses, cobwebs, rats, lizards, all kinds of rodents have their home there. You will begin to wonder, but this is the head department of a local government. I'm not talking of even the state. Talk less of the federal. Go to federal government-owned health institutions and see the environment to yourself. So the problem we are having here is that there is a total collapse of leadership. And until we get it right, nothing will work. How can the Lagos state government give such an order? How do you think on earth it will be obeyed? Who will obey it? So we have to change the way we reason in our leadership upbringing. Thank you.
All right. Thank you for calling to share your thoughts. He says, how can the Lagos state government give that kind of directive? Who do you think will obey such an order? Hello to you. Good evening.
Good evening.
Good evening. What's your name?
My name is Samora Bay. I'm calling from Kurudu.
What do you think about the Lagos state government's directive to returnees from China to self-quarantine?
My view is a wrong one. I think they are trying to run away from their responsibility.
Okay.
Because people coming from there, if suspected of anything, government should be able to be alive to their responsibility, quarantine them by themselves, make them to be thoroughly checked, and if found in any way that they have contacted you, treatment should start immediately. Asking them to quarantine and take a big risk, because as you know, Nigeria, we don't obey the law. Although it is for our life, to save the life of that person. And if it's not properly handled, it will spread. So what I'm saying next is that government should be allowed to their responsibility. They should not run away from it. Don't ask the person to go and guarantee himself. They should provide the facility and make sure that that person is guaranteed immediately. So that is my position.
All right. Thanks for calling to make it. Hello. Sorry about that. Our numbers are 01277 0993, 01277 1993, 01277 2993, and 01277 3993. Good evening to you.
Hello, Sandra.
Hello to you. Good evening.
Yeah, good evening. My name is Ike Chode. I'm calling from Keja Airport Road.
Ike, what do you think about the Lagos state government's directive for returnees to self-quarantine?
Yes, I even heard it from the governor himself and the commissioner of health that they will take the address, the phone number, and the name of the person, and the person will go home and stay for 2 weeks and do self quarantine. It doesn't work. That will not work.
Why?
Nobody will sit at home, even when he's not feeling fine. Just go and sit at home. Not on top of when he's feeling fine for the time being. They will move about, they will walk. But did you hear this morning that some patients in China were spitting on their doctors so that they will contract the coronavirus too?
Some patients in China were sleeping on their doctors to contact
On their
coronavirus.
doctors, yes.
I have not heard this.
We had it on the news this morning.
Wow, I haven't heard this. Wow, that's a huge one. Thanks for calling to share that. Hello, good evening. 99.3, hello.
Hello, good evening.
Good evening to you, sir. What's your name?
Yeah, this is Innocent from Ikeja.
Yes, welcome.
I just want to react on one particular thing based on the Lagos State government directive.
What do you think about that?
Good. Thank God that the Lagos State government have given a directive.
Okay.
Has federal government given a directive?
Okay.
I think the answer is no.
Well,
But I don't think
well, the federal government has given a directive. They've ramped up screening points at different borders. So it depends on what you mean by giving a directive.
directive that anybody that lands from Murtala Mohammed will go home. That's Lagos State government directive.
Okay.
Any directive from Abuja?
Not that I know of.
Thank you very much. So kudos to Lagos State government. But one thing I want to tell Nigerians is this. Everything about life is money, 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 and money.
Okay.
You know what is happening?
What?
What is happening now is that what is it called? The virus come into this country, money will be released. And that is what they are looking up to. Your life and my life doesn't concern them. So anybody that is looking up to government to do something, that person is on his own or her own. That's my own.
All right, thanks for calling to make that point. But it's not unreasonable for people to look to government to safeguard their lives. Because again, I go back to that point that I was making about exterminating rats. And my caller, Mary Jo, called in and said, buy Indoseed, buy this, take care of the rats in your house. But do you know that even if you exterminate the rats in your home, if government doesn't exterminate the rats in the bush, they will eventually move into your house. And sometimes they've been there for a while doing damage and you don't even know. So should we not be also insisting, on the one hand, while we are increasing our own personal hygiene, insisting that government is also doing its part to ensure that we are all healthy? It is part of their responsibility, after all. And then back to the very valid question, how do we teach ourselves as a people to handle our food better? What do you think can happen there so that more Nigerians take their personal hygiene seriously? I've heard complaints of people who go and pee in the bathroom, and after peeing they'll shake and shake and shake and put it back in there, and then they'll come out of the bathroom and see one of their men them coming back into the bathroom and say, "Hey, my guy," and they didn't wash their hands that they just shook with. Because they're not conscious of, I have to wash my hand after using the bathroom. I've seen so many people, men and women alike, go into a bathroom, use it, come out without washing their hands. If I'm there, I'm always like, wash your hand. And they look at me like this smart person telling people to wash their hand in the toilet. But it drives me mad. It's from simple things like that. Hand washing. How do we get more and more Nigerians to realize why it's important to do that? Or you go to buy Iyabasira food and she has kata, and she will wipe with her nose. She'll wipe her nose with the back of her palm and then give you food to eat with the same hand that she used to wipe her nose. And you collect and eat. How do we teach her to not do that? Whose job is it to teach her to not do that? Is it my job as the president of Hard Facts? Is it your job as a concerned citizen? Is it the job of the government? Whose job is it? And very importantly, What do you think about the directive of the Lagos state government for people who are returning from China to quarantine themselves for 14 days? 01277 0993, 01277 1993, 01277 2993, and 01277 3993. Hello, good evening.
Hello.
How are you?
Fine.
What's your name?
My name is Ezekwesili.
Ezekwesili, welcome. Go ahead.
I'm calling from Ikotu.
All right, go ahead.
How can Lagos state government leave their duty and hand it to the civilians to do? Because I don't understand. They are the ones that's supposed to be at the Murtala Mohammed airport to take everyone that is coming to Nigeria from China. Not telling anybody to go home and stay 2 weeks before you come out. Yes, Nigerian government, they are not doing their job. If it is to manage oil, resources, all of them will fuck up their eyes to control it. They can't even save our lives. Every country abandoned Chinese from entering our country, but only Nigeria. It's unfair. And it is pissing me off.
Ezekwesili, thanks for calling me. Hello, good evening.
Hello, good evening. Finally. Sandra, good evening. My name is Jonah.
Jonah, welcome.
Now, wow, Sandy. Happy New Year.
Happy New Year.
I have been trying you since from Big 3.
I'm hot cake now.
Fever, everything until we reach here.
I be hot cake. Welcome.
You are cake. Person of the Bible.
Go ahead.
My sister, concerning penetration, as the last caller said it, those that have been deported from China, because there's no other state that these people will land. It's Lagos State. I think this is our international, right? So it is from international airport that our Nigerian health workers to scan those people, because we have already heard that abroad at China there's this disease, and we have checked over, we have nothing in Nigeria. So anybody that comes from China, Lagos state government should take very, very responsible on them and check it very well. Keep them in one place. Let them see that like maybe 1 or 2 months that this disease is not here. Now they cannot allow them to enter public, because it's not just we should live like that. For example, as you said concerning Patrick Sawyer that come with Ebola. Then secondly, concerning how we are going to deal with rats. Because even I myself, I have a problem with my neighbors. If I buy like Indocin or other rat poison, because anytime I see rat move in my kitchen, oh my God, I feel like crazy. So I have to go and buy some rat poison and put it inside food, either in fish or sardine, something very smelly that can attract rats to kill them. So if the rat run away to my neighbor's house or to my neighbor's other area to go and die, they'll begin to abuse me. Say, why do I kill rat? Get it. So you can see that the rat is smelling wherever. So you can see how, no matter how you do to Nigeria, my sister, we can never learn.
No, but you know what you do next time when they abuse you like that? Tell them, you, Matu, kill your own rats. And once he starts to smell, take it out and clean your house with bleach now. It's for your own good. If I allow these rats to live now, all of us will die of Lassa fever.
I'm telling you, I used to tell people if there's some things like you see the thing inside house, like a lizard like that, but it's very, it is very pink, like that. So that will also cause disease. If that thing touch food, it will cause your body will be rotty. Because I used to read it on internet every time, every moment.
It's not everything. It's not everything you read on internet you believe. Oh, that one is not. That one is not.
But madam, even right when I was small, I know that thing is killer disease. It's very small like rat like that, but it used to stay inside house.
Okay. All right. Well, thank you for calling me. I appreciate it. And I hope next time you call me and I pick it on time. Thank you to everybody who was a part of today's episode of Hard Facts. Hard Facts returns tomorrow at 3:15. Join me. All right. We'll start with the big 3 as always. Today's big 3, I told you that there were more developments in the Okada and Keke restriction. I told you that customs boss said that Nigerians are naturally criminal. But the Accountant General, the Auditor General of the Federation, said that customs is behaving criminally. I told you that story. If you missed it, you can watch the Big Three on Facebook and YouTube, Nigeria Info FM. I also told you that the US government says that the Nigerian government will repay Abacha loot if it squanders it. And I wonder what you think about that. Let me know on Facebook, all right? My Facebook is Sandra Ezekwesili. My Twitter is also Sandra Ezekwesili. And so is my Instagram, Sandra Ezekwesili. On the Big Hard Fact, we just talked about Lassa fever and the coronavirus. And today's glass ceiling, we talked about the idea of women getting fired and not getting employed whenever male employers are worried about attraction. I told you that Pastor Adeboye advised a young man to fire his secretary, who he was excited to see every time he went to work. We'll continue that conversation next week, Wednesday at 4 o'clock, because a lot of you couldn't share your thoughts, and I really like you to share your thoughts. Until tomorrow at 3:15, when I come back on Air Lagos, those were your hard facts. Good night.
We keep you informed, we keep you company, and we give you access to pour out your mind, even throughout the night. We are the first talk station of the nation. We are 99.3 Nigeria Info. Nigeria, I'm listening.